Hello and welcome to another episode of Cracking Addiction with Philippe Naren and Fergal Armstrong. In the episode of Cracking Addiction today, we're going to be talking about GHB or gamma hydroxybutyrate, but we'll also briefly touch on its prodrugs, GBL, gamma butyrolactone, and 1,4-butanediol. So Fergal, sometimes GHB is interchanged with GBL and 1,4-butanediol, but they do kind of interact in slightly different ways. Could you talk us through the differences between GBL, 1,4-butanediol, and GHB?
Okay, so GHB is derived from GABA, as are the other two drugs we're talking about. And GHB is a agonist at the GABA A receptor and a partial agonist at GABA B receptor, and that's how it exerts its inhibitory function. Now, the other two drugs act in the same way as well. However, there are some differences. So in the case of GBL, we know that at lower concentrations, it's able to exert a greater sedative effect. So it's more potent milligram per milligram. And we also know that in the case of butanediol, we know that it's metabolized by different mechanisms, including acetaldehyde dehydrogenase. So its effect can vary depending on the activity of that enzyme, and so it's less predictable. So overall, they tend to act in the same mechanism, but they may have different clinical effects because of either different potencies or different kinetic metabolism rates. So they are part of the same family, and they can all be thought of as potent inhibitors of brain function.
Absolutely. Now, something I found quite interesting in that in our lives as addiction medicine doctors, we mainly see people who use GHB recreationally. But GHB does actually have some medical and clinical effects. Could you expand a bit more about the medical indications and conditions that GHB has been used for?
So we know that it's a potent GABA agonist, so it's a potent inhibitor of the brain, but it also increases the amount of slow wave sleep, that's restorative sleep in the brain. And as an indirect effect, that also then increases growth hormone. Now, in Italy, GHB is used as a drug for replacing alcohol. So it's a harm reduction intervention. So just as in Australia that we would use baclofen to reduce craving for alcohols, in Italy, they use GHB. And so you have GHB clinics in Italy. You just go and you get dosed and off you go for a week. The other medical indication is when we're talking about narcolepsy. And so remember, I said that it increases slow wave sleep. So narcolepsy is a disorder of sleep, and GHB is used to treat or prevent the REM intrusion into normal daytime wakening, and also to give people a good night's sleep at night. Now, the other indication for GHB, again, relates to sleep, and it can be used to treat fibromyalgia, because we know that fibromyalgia is related to sleep deprivation, and people who have poor sleep tend to experience worsening symptoms of pain and fibromyalgia. And so the GHB has been heroically, I would argue, somewhat heroically being used to ensure sleep in those patients. And that actually is a known reason for doctors to be prescribing GHB. Now, I also said that GHB indirectly increases growth hormone surges, and so therefore GHB is used in the bodybuilding fraternity and misused in the bodybuilding fraternity to elevate growth hormone levels to increase muscle mass. So it has got a wide range of downstream clinical indications or indications for misuse, as the case may be. But it all boils down to it's an inhibitory drug in the brain.
Indeed. And I guess for some of the other areas that GHB is used, and probably more so in the areas that we see it in addiction medicine, is sometimes it is also used as a stimulant recreational drug in lower doses, but also sometimes as a ChemSex drug as well, particularly in men who have sex with men. And that's frequently where it's used recreationally as well. It also, because it is colorless and odorless, has unfortunately developed a reputation as a date rape drug. It's sometimes put into alcoholic drinks to kind of hide its bitter taste. And we also frequently see it in those kind of settings. Would you agree with that, Fergal?
Yeah, totally. And I think it's really important to also emphasize, sorry, I forgot to mention earlier, but a third action, it actually is associated with dopaminergic firing. So on the one hand, it's a sedative because it's an agonist at GABA A and partial agonist at GABA B, but it's also associated with a dopamine rush, which actually is a stimulant. So it's got a biphasic action. And that also contributes to its euphorogenicity and its use as a drug of addiction. In the situations that you've already described, so we've got, the date rape ChemSex situation as well as just pure euphoria.
And with regards to how GHB is used, it's most commonly in Australia anyway used orally, but it can be insufflated, rarely injected, and also absorbed mucosally. But when it's being used in more medical terms, as you've mentioned in Italy, my understanding is it comes as a GHB sodium salt. Is that correct?
Yeah, it is, and it's also then dissolved into water. But going back to its use in Australia, I mean, it does, as you say, it does have this bitter taste. So I often think of it as the martini cocktail of misused drugs, because I don't like martinis because they are bitter and there's too much salt. But for that very reason, GHB is actually mixed in with martinis. So because it is so bitter, you can detect the taste in if it's been added to your drink, if your drink has been spiked, if you're drinking something sweet. But you can't really detect it if it's in a martini.
Yes. And I think one of the things that makes GHB so effective but also dangerous is both the duration of effect and how quickly it takes effect. I've certainly seen numbers where the onset of effect of GHB can be from 10 to 20 minutes from usage. Peak usage can occur within 45 to 90 minutes. And the total duration of usage can sometimes be, or total duration of effect can sometimes be 2 to 4 hours. And this is from really small volumes of substance. And we're talking 0.5 ml to a ml. And the thing to be aware of, as you said earlier, Fergal, when you were talking about GBL, because GBL is the prodrug, you must not take the same dose of GBL as you would GHB, because you could overdose. And sometimes with GHB, it's 0.5 ml or even 0.1 of a ml can be enough to overdose. Have you seen things similar to that?
Yeah, totally. So I think that the dosing is absolutely critical, and there is a biphasic dose response. So at very low doses, it causes euphoria. Then at moderate to higher doses, it then causes drowsiness, respiratory depression, and coma. And, one of the key things about GHB is that it causes amnesia. So you don't remember that you've just got high, or that you don't remember that you've just lost consciousness. Therefore, you don't think that drugs had any effect. Therefore, you take more of it. And so you end up in this ever-increasing cycle of higher and higher doses to achieve what you perceive as a positive beneficial effect. And really, I see a number of patients, very young patients, who misuse GHB, and they think it's a cool party drug, but they don't actually see the effects of the profound sedation, which includes loss of fecal and loss of urinary continence. So effectively, I say to these patients, well, do you think it's cool to lie in your own shit and piss? Because that's what it is, unconscious, potentially you're lying in your own vomit, your own shit, your own piss. Now, if you vomit, you really are in danger because you've lost your airway as well. But, it is a profoundly dangerous drug with profound social consequences, which young kids don't really get.
Indeed. And as you mentioned, it has such a narrow therapeutic index. A 0.5 ml, even less than 0.5 ml, can cause an overdose and cause people to get significantly obtunded, be at risk of respiratory depression. But also, I think the concern is also of developing dependence. Could you talk to us a bit about GHB dependence and how easy it is to get dependent on GHB?
Yeah. Well, I go back to my previous comment about the amnesia, so you don't remember that you just got high. So that's one of the reasons why you end up with escalating doses. But really, it's very easy to get dependent on GHB very quickly. So tolerance is a big issue. There are a couple of hallmark risk factors I use for dependence. If you're using every day, if you're using more than 20 mils, if you're using multiple doses throughout the day, so 3 to 4 times in the day, and if you're using at night, or if you're waking up to have to use at night, these are really high risk indications for potentially a high risk GHB withdrawal. And I suppose out of all of them, it's the total volume in the day. If you're using more than 20 mils a day of 1 milligram per mil, which is more than 20 milligrams, you're using 20 milligrams a day. That really worries me in terms of how dangerous is your withdrawal going to be.
And I think the thing also to be mindful of is two other things, is that GHB can have a stacking effect. So if, say, your first dose is 1 mil, you really need to be aware that the effects are additive and that the next dose should potentially be a bit lower just to try and mitigate against harms. And also because GHB has such a short half-life, people can go into withdrawal. I've seen people go into withdrawal half an hour to 45 minutes post using GHB as well. So you mentioned waking up in the middle of the night, or I think it's called charging, because people get into withdrawal at all hours. So people are waking up every few hours to use GHB. So it's one of those substances that really does take over people's life when they become quite dependent to it. It's so dangerous where people can, as you mentioned, have seizures or fall into respiratory depression in withdrawal. So it's something to be aware of.
Yeah, I liken GHB withdrawal to alcohol withdrawal. And I say, look, GHB withdrawal starts sooner, is more severe, and lasts longer than alcohol withdrawal. So it really is perhaps, I think, the most dangerous hypnosedative withdrawal syndrome that we deal with routinely. But you also mentioned a number of other side effects of GHB use. I mean, you mentioned seizures. It does have a range of clinical presentations apart from hypnosedation. So do you want to talk a bit about what I would term as the GHB idiosyncrasies?
With regards to the GHB idiosyncrasies, the main ones are it can be an irritant to skin and it can cause acute eczema. Again, as we mentioned, GHB has a really short half-life of up to 30 minutes. And so that is of concern, and that can be why people really need to use GHB quite frequently and will use it even during nighttime. It can cause seizures as well, particularly over-ingestion of GHB, as well as sometimes withdrawal. There's also you can, with GHB usage, develop nystagmus, both vertical and horizontal nystagmus. We've also mentioned that prolonged GHB usage can cause anemia, which can, again, increase the risk of overdose due to people not being aware of how much GHB they've used. And also GHB can cause hypothermia as well. So those are the common GHB idiosyncrasies. And I guess coming off the idiosyncrasies.
Sorry, I just wanted to make that point, or emphasize the point that you said. It's really important to understand that hypnosedatives, in particular GHB, even in intoxication, can cause seizures. So when you're seeing someone who presents with seizures in the context of GHB use, it's not automatically a withdrawal phenomenon. Everybody thinks that seizures equals withdrawal, but GHB intoxication can cause a withdrawal. Sorry, GHB intoxication can cause a seizure, as can alcohol intoxication. So these hypnosedatives in intoxicating doses can cause seizures, even though we assume that seizures are a manifestation of withdrawal. So you really do have to be very careful, because the management of GHB intoxication is not benzodiazepines.
Absolutely. And I guess following on from that, Fergal, what's the acute management of GHB intoxication? Because it is one of those things that we do sometimes see where people present intoxicated with GHB.
So if you're watching in the community, the key thing to understand is that the management of GHB intoxication is to call emergency services because of the risks of that profound sedation and that profound risk to the airway and the risk to loss of life.
And that's a really profound statement, and something that we do really need to harp on about, at how severe acute intoxication with GHB is. And I guess in this episode of Cracking Addiction, we've covered a lot. We've talked about GHB, its prodrugs, GBL and 1,4-butanediol, the dosing, the short half-life of GHB, the symptoms of intoxications, and this role of supportive management in GHB intoxication. So we've covered quite a few areas, and in the next episode of Cracking Addiction, we'll expand on how to manage GHB withdrawal. So thanks very much for your attention on this episode of Cracking Addiction, and bye for now.